Good morning, Mr. Jones.
Hello.
I'm Helen.
Hello.
I understand from your doctors that you're going to need a PICC line to give you some medication that they've decided that you needed. So my job is to actually fit that for you.
Okay.
And what I'd like to do is to just find out whether you're left or right-handed.
Okay, I'm left-handed.
And then we'll just pop this tourniquet on. Now then, if I could just ask you to turn your arm over like that. And then we'll have a look and see if there are any veins visible. Okay? Not too uncomfortable?
No, it's fine, thank you.
Good.
For the placement of a PICC line with ultrasound, hand washing and maximum barrier precautions are mandatory.
I'll explain everything as I go along. And if I cause you any discomfort, you must tell me. Okay? Could you just lift your arm? Now, the next thing I'm going to do is to clean your skin.
The skin should be cleaned around the insertion site with 2% chlorhexidine and 70% alcohol.
Okay. Now, just while that's completely drying, I'm just going to prepare the ultrasound sheath so that I can put a sterile sheath onto your skin. Okay.
With the help of an assistant, pass the ultrasound probe into a protective, sterile sheath.
Mr. Jones, I'm just going to have another look at your veins on ultrasound before we start. That area should be numb, but if it isn't, I really do want you to tell me because I can give you some more local anaesthetic. Okay?
Use the ultrasound to identify a suitable vein for cannulation. When you have selected a vein, access it with an echogenic tipped cannula. Then get your assistant to release the tourniquet.
Can you just set the tourniquet down in a minute, Paul?
Now advance the nitinol guide wire into the vein.
All right.
Yeah, no pain at all.
Jones.
It's fine.
And remove the needle.
Just taking the needle out of the vein now, leaving the wire in position. Is that numb?
Yeah, I've nothing I can't think.
Sure?
Yeah, absolutely.
Using a scalpel, slightly enlarge the puncture site to ease the introduction of the split sheath dilator. Now, pass the dilator along the guide wire to the skin. Gently insert it all the way into the vein.
Push coming now, Mr. Jones.
Withdraw the guide wire.
Are you comfortable?
Absolutely, no problem at all, thank you.
Just taking the wire out of the introducer.
And then remove the introducer. Using a pair of non-toothed forceps, pass the PICC into the vein to the desired depth. With the PICC in place, firmly grasp the extensions on the dilator, bend them downwards until the sheath splits and slightly withdraw it. Ensure that the PICC does not withdraw with the dilator and continue this splitting withdrawing action until the dilator is completely removed from the skin. Using a syringe filled with saline, check the pick for venous return. And then flush it. Remove the syringe and fit a Vigon Bionector neutral displacement device to the hub. You must now thoroughly clean around the insertion site and then apply a suitable skin fixation device. In this case, a grip lock.
So clever.
Apply a small pressure dressing over the skin puncture whilst the drapes are removed. A transparent dressing will allow you to monitor the skin puncture site for possible bleeding or swelling, thereby ensuring correct care and maintenance of the in situ cannula in accordance with your hospital's protocol. On completion of the insertion, an X-ray is mandatory in order to ensure correct tip placement.